But thank you all for taking the time to jump on the call real quick. I sent out an email to all the county employees last week. Just want to, one, share a little good news about vaccine, and to also encourage everyone to be mindful of um, the holiday, the upcoming holiday. And I want folks to, gather and celebrate in a safe manner. So I'll just start briefly, give some high level updates about the vaccine, and then I'm going to leave time at the end for you all to ask me questions that you may have about our process here in the county. And so I am going to go ahead and mute everyone um, just to make sure folks can hear me speaking. And then when we get to the Q&A part, you can either type your questions in the chat box, or you can individually unmute yourselves when you have a question. Sounds good to everyone? All right. So again, welcome. So as I said in the email that I sent out on Friday afternoon, we received good news over the weekend. Those of you that have been following, you know that the Moderna vaccine received its emergency use authorization approval from FDA, CDC. And so we are now awaiting shipment of vaccine here in Orange County. The health department, we are slated to receive shipment one day this week. Unfortunately, I still don't know when that is. Hoping it's going to be Tuesday or Wednesday, so that no one has to come in on the holiday time off to take receipt. But I still have not received confirmation of when we will receive our vaccine. I only know that we are scheduled to receive some of the Moderna vaccine this week. We're receiving under 1,000 doses. So just as I've said in other public communication, limited supply early on. So this is the case for everyone that is receiving the vaccine. We are receiving limited doses in the beginning, but as time continues, we'll continue to receive more and more vaccine. So I guess just some brief stuff. The Moderna vaccine has been approved for those 18 years of age and up. It's a 2-dose series, so you'll get the shot, and then you need to come back in 28 days to get the second dose in that series. Right now, we do not know what the duration of protection is for this vaccine. It is still under clinical trial study. So I think those are some of the big questions that I know I have received to date. Prioritization, this is one that everyone is interested in. And so in the email I shared with you, the priorities for phase 1A, 1B groups. And so vaccine is being used, is being prioritized on a risk-based kind of analysis, meaning they're considering 2 factors as we chose the priority groups for this vaccine. We here in Orange County, we are in alignment with the North Carolina Department of Health and Human Services vaccination plan. So we didn't go rogue and off script and make our own priority groups. We are in alignment with the state and the priority groups that they have outlined for us. And so the 2 factors that they consider when they chose the priority groups: one, what is your risk of exposure? So based on your job and what you do, are you at high risk for exposure? And then 2, risk of complications if you were to get the virus. So you will recall in 1A, our priority groups include healthcare workers, specifically those that are taking care of treating or cleaning areas where there are COVID positive patients. So that's a big priority group for our area. And then the second group, long-term care facilities, and that includes residents and staff. So if you recall, early on in the pandemic, we specifically here in Orange County, we were hit hard with our long-term care facility, our nursing homes. They had the outbreaks, and unfortunately, that's where we saw many of the deaths. So they are absolutely in the priority group and first on the list to receive their vaccine. So when we receive our shipment this week, the group that we plan to prioritize and really try and get some vaccination going before the holiday includes our long-term care facilities, staff, and residents. So that's how we plan to use it with the first couple of doses that we get here in Orange County at the health department. Then we will move into, after the holiday, we'll move into doing vaccination for those healthcare workers, frontline folks that are treating and caring for COVID positive patients. So that's the priority we're using here in Orange County with that first shipment of vaccine that we received. Questions so far? And again, you can put it in the chat box, or if you want to unmute yourself, you can individually unmute your mics. No? Okay, well, I'm gonna keep plugging through my notes. So a question that I'm getting from lots of county employees: well, how will we know when it is our turn in our group? How will we know where we fall in the priority group? And so I've had conversation with county manager's office. We'll be working with department directors and HR. For department heads that are on the call, you remember early on in the pandemic, we had to submit a list to HR listing out our essential employees. And then we had to put some more information about, well, who's working remotely, who's coming on site and working, and possibly having physical contact with the public during this pandemic. So we're going to use that list, like I said, in conjunction with department directors and county HR to figure out and prioritize to ensure that we get our frontline essential staff vaccinated accordingly on the priority groups. I'll speak for me, health department staff. For us, it will mainly be our clinical folks that will be first up because they are in contact with patients directly on a daily basis. But for those of us that are working remotely, we have less risk, less exposure, so we'll be a little further down on the list. Even though we are considered quote unquote healthcare workers, again, we're prioritizing those that are in direct contact with the public and possibly COVID positive patients. So stay tuned. The other thing that we're looking to do is also work in coordination with the other towns in the county. So we want to work with Carborough, Hillsborough, Chapel Hill, and we want to make sure we're all on the same page and prioritizing our workforce in the same manner. So more details to come soon about priority groups and where you'll fall on the list for your vaccination. So once we get all of that hammered out, then the health department, we're working very closely with EMS department, emergency services, emergency management. We're working very closely with them to identify our public points of dispensing. So we'll let you know as soon as we get all of those logistics and details outlined, and we will tell you where to go for your COVID vaccination shot. We are looking to use a drive-through model, so we don't want folks to have to congregate inside of a facility or a building, so we're looking to use a drive-through model for the vaccination process. So with that, I am going to stop and really turn it over to you all to ask me questions. Again, you can use the chat or you may unmute yourself.
Quintana, this is Rita, and this may be misinformation, so I apologize if it is. But I had heard on the news this morning that there is now a new strain and that they found in Britain, and I was curious if the vaccine accommodates for the different strains that may come about.
Right. Thank you, Rita. And that's a great question. I heard this too over the weekend. Last night, as I was looking at the news, I heard there is a new strain of COVID-19 over in the UK, and as a result, they are going back into complete shutdown. I will be honest, I don't have enough information right now to speak with much confidence about that as to whether or not the COVID-19 vaccine will cover that. But I will say, and I know I have some clinicians on the line, so feel free to jump in if you wish. But I would assume it will be very similar to maybe our flu vaccine. And so while we predict and they put the strands that are circulating in the flu vaccine each year, I would assume that with COVID, if there is in fact this novel strand of mutation of the virus, that if you get the vaccine, you have some protection, if not 100% spot on protection for that new strand, but you have probably some protection. That would mean if you were exposed to that new novel virus, then you have a little protection, if not solid protection all the way.
Thank you.
You're welcome. Thank you for the question.
So Quintana, this is Janice. So the hospitals have gotten their own shipment, correct, of the vaccine? So our
Mhm.
1,000 doses are for the community and our long-term care, but not for the hospitals.
Correct. And so it's less than 1,000. But yes, the hospital has their own allocation that they receive each week. And then we at the health department have an allotment that we will receive. And we are not expected to vaccinate the healthcare staff that work for the hospital system.
Quintana,
Uh-huh.
we will be vaccinating dental practices, medical practices, those that are not affiliated with UNC and Duke, and that is our responsibility as the health department.
We will be vaccinating those providers. Yes, ma'am. And let's see.
So it's Janice again. If you're going to do the drive-through, just know that, our new parking lot down at Southern, you're welcome to use that, because I assume doing the drive-through, you're going to have folks pull over and wait to see if they have any kind of reaction
Yes.
to the.
Yep. Thank you, Janice. That's something I meant to say in my notes. But yes, so that is a requirement of this COVID-19 vaccine, is that we do have to allow about 15-30 minute window for observation after you receive the vaccine. And so yes, we will need a way for folks to pull over and sit in the observation period for a time before they are released to go. And so I know I see Rebecca's on the call, so she just make a note that agent has offered up their parking lot in the event that we need to consider another space for the drive-through vaccination. Thank you, Janice. I see
You're
a
welcome.
question or two in the chat. So thanks, Caitlin. Knowing that North Carolina has prioritized jails and prisons, how will individuals incarcerated at the Orange County Jail be identified for prioritization with 2 or more risk factors or age? And so, Caitlin, I think we'll probably work with the detention center the same way we have with some of the employers for the healthcare facilities for the 1A. And so we'll just be in contact with detention center, and then you all can help us gather that list so we know of the individuals eligible for this phase 1B priority group.
There's a question from some of the public defenders and some of our staff that work closely with folks over at the jail that maybe nursing staff may not be fully aware sometimes of some of the at-risk conditions. And if they know of somebody who hasn't been identified by the nurse, should they share that with the health department, or what would be the protocol for that?
Yeah, so they can call and talk to our team, and we'll figure out how to gauge that. While it is open to everybody, remember the one thing that's important: folks have to give consent. So individuals have to give consent saying that they want and they're willing to receive the vaccine. So yeah, just have them reach out to Rebecca and Mike DeFranco are kind of running point on the vaccination work right now.
Thank you.
I have another comment from Leslie. I've gotten a number of questions regarding how the general public can sign up for the vaccine. Any information about this? And so yes, and right now we're trying to whittle out. This has been a unprecedented type of event, right? The whole 2020 pandemic has been, but the rapid way in which the vaccine has become available and how we're signing folks up to get everyone vaccinated, that is being done through the creation of a CVMS, a COVID vaccine management system. And so the state is working hard, tirelessly, to adapt and tweak that system so that it meets all of our needs. And so I know the state, we had some downtime for a big chunk of the day on Saturday where they were doing some upgrades and some enhancements. And a lot of that work will address this very question. So while I don't have the link readily available right now, as I said in the email that I sent to you all, as we move to the different priority groups, Health Department will send out public notification announcements, all of our social media platforms, alerting folks that this is the group we're now reaching out to so that they may sign up for their COVID-19 vaccination. And so in that communication, we will have like a link or something where folks can click and they can start the process for signing up to get their appointments scheduled. In addition to that, they've also made some tweaks. So we actually have paper forms. So once we have our vaccination sites, nailed down and we start to publicize those, we will have the opportunity to just sign folks up whenever they show up on site. So if you don't have an email address or internet access, there will still be a way for a patient to walk up and get registered real time and get scheduled for their vaccine. Judy Butler, since the local firefighters are not county employees and they do respond to medical calls, will they be vaccinated at the same point as our county emergency services staff? And yes, the answer is yes, Judy. We have included them in our group of those first responders with direct patient care. So yes, we will take care of them as well. Others? These are good questions, you guys.
Hi, Quintana. Is this process, does it vary by county or is it the same kind of across county? Like I have services being provided for my child from somebody who lives in Durham County. Can she expect the same type of prioritization as the folks in Orange County?
Yes, I would say across the state, we're all required to follow the prioritization groups that the state has outlined for us. So yes, it should be a similar response from county to county.
And Quintana, you know how when the flu vaccine comes out, one of the things that they will say is that if you have an allergy to eggs, you should probably not get the flu vaccine. Is there any such information regarding the vaccine and reactions
Yes.
similar
So
to that?
Yep, there is. So right now, and we'll be sure and post all of these vaccine FAQ sheets on our site. I know Kristen and the group just developed a vaccine site. But yes, there is some caution around if you have known adverse allergic reactions to vaccines, then yes, it is not recommended that you get the COVID-19 vaccine. What I would say is you should call and have a really in-depth conversation with your primary care provider if you have questions and you're concerned about that. On this list, they also list what the ingredients are for the COVID-19 vaccine. And so you can look over those to see if you have some known allergies to the ingredients in the vaccine. And so again, so thank you, Kristen. Kristen has just put the link to the COVID-19 vaccine website in the chat box. So be sure and check that out. But we will have all those FAQs there. And there is one that actually lists all of those things.
But it's not egg based, so it's not, you don't have to worry about egg allergy.
Yep. Some folks have asked about known side effects from getting the shot. And so if you do not have a known allergy, you won't have that allergic reaction to it. But some of the other common things that are being reported are some of the pain, tenderness, maybe swelling at the injection site. Some of us may experience that when we get a flu shot each year. And then other things may include fatigue, headache, maybe some muscle pain, joint pain, chills, a little nausea. But it's my understanding it is not something that is long term. It's not a long term side effect, maybe 24 to 48 hours. And then folks are feeling well and back to some sort of normalcy. And I think that's probably a good sign. That means that your body is actually responding to the vaccine, because the vaccine does not contain the actual COVID-19 virus, but it imitates the virus. So your body will start to build some of those natural antibodies, so that if you were exposed to the virus, you have that immunity and your protection. So to have a few of the side effects is probably a good thing, because your body's trying to build up some of the natural antibodies to the virus, the imitated virus. Let's see, Leslie had another question in the chat. Will ID be required for vaccine? I'm wondering about undocumented folks with no ID. I am pretty certain that that answer is no. I know here at the health department, we will not require ID. I have not been far enough into that CVMS system, but it is my understanding, I don't know that there's a point where ID is required. So we will try to remove all barriers to anyone getting the vaccine, the same way we did for COVID testing. So no ID will be required. We want any and everyone that would like to receive the vaccine to come out and get it. The vaccine will be free of charge, so no out-of-pocket expense to patients that get the vaccine. Some providers in the community will be charging the insurance and administration fee for the vaccine, but there's no out-of-pocket cost to patients receiving the vaccine.
Is there any contraindication for people who are going through radiation, chemotherapy, or on immunosuppressive drugs?
I am not certified to answer that question. Good question, though, Rita. So I will say they need to check in with their primary care physician to make sure it's okay for them to get it.
Thank you.
Uh-huh. Others? I would say go ahead and ask, because you really have the full team on here right now. I see most of my folks from the health ed, the communication group, and Rebecca's a strong arm with the logistics planning group. So shoot your
I
best
came
shot,
a few
guys.
minutes late. I had a question.
Okay.
I came a few minutes late. I work in the health clinic. What was the plan for, like, what team will be doing the vaccination? And did we go over that and I missed it, or?
Nope. So you're asking who's this? Is this Debbie? I think
It
that's your name.
is.
Hi, Debbie. So we have, thanks. So we have multiple folks, volunteers, professionals that will help us with vaccination. So some of that includes our EMS staff, some of the EMTs, paramedics. I know they'll help out early on, but then we're also looking to sign up some folks from the School of Nursing to also assist with vaccination.
Okay.
And hi, Jim. I saw Jim put a question. He says, well, how are y'all doing? Thank you, Jim, for asking. And I'll turn that over to not just myself, but anyone can answer that. Jim, I'm doing great. I am counting down and looking forward to Christmas. I finally did put a tree up. It's not decorated, but the tree is up and the lights are all connected. So I'm looking good. I'm feeling good. Feeling hopeful, excited to have the vaccine starting to come out, and yeah, looking forward to 2021.
Oh, I'm glad that y'all are doing well. It's a lot of work. I can't even imagine. And thank you for everything. The hard work's just starting, right? I mean, this is, we thought, oh, the vaccine, that's great. But I can't even imagine what y'all are going through logistically. So thank you.
Yeah. Well, thank you. And thanks for all your support too, Jim. IT, you guys are a true backbone for us and all the operations that we've had to do this year. So thank you all too for all your support and hard work.
No problem. Thank you.
Quintana, it's Janice again. So I saw something in the news over the weekend that folks that are over age 75 and employed, that they were going to move higher up the list. Did you see, or like, because I'm thinking we're going to start getting a lot of calls, from older adults.
Thank you, Janice. So I didn't really speak on it because I know that's still out for some conversation. But yes, over the weekend, the ACIP, Advisory Committee on Immunization Practices, I think. But they did make some recommendations back to the state about changing some of the priority groups. So there's now talk about creating a 1C priority group, and it was absolutely including those 75 and older specifically as a group. And so we are awaiting guidance from North Carolina DHHS and where they're going to pivot or if they're going to make any changes to our existing framework. So yeah, stay tuned, but it is on the radar and it is something that ACIP made a recommendation about this weekend. Judy has a question. Will the new website have info geared to the local medical providers too, or just for the general public? Good question. And so I think initially it'll be for the general public because I think we're really counting on employers for the medical providers to push some of that information out. But actually, it probably will be a combination of both. I think medical providers will also be able to go to our site and figure out what they need to do if they still have staff and their team needs to be vaccinated. So I'm guessing, and so I'm looking at Kristen and Donna, but they can't see me looking at them.
Yeah,
But
no,
so
we got you.
Yep.
So we had a discussion this morning, and because we contacted a lot of folks last week, Kristen's going to put up a little notice just to say, where we are as far as we're in the process of registering, and those folks that it's your time, we will make sure that we reach out and contact you, but just sit tight. And we'll also, on this webpage, we've got the toolkit for healthcare providers, also some stuff for the general public. So just a little notice so folks don't think they've missed anything, that and as we learn more about how folks are getting into CVMS, we'll make sure that link is there. But just to let folks know, we've got their name and they'll get called when it's their turn.
Thanks, Donna.
And for the general public, they are really talking about spring. So it's really hard for folks to register now and have to wait. But for most folks, it's not going to be in the next 2 months. It's going to be longer. Would that be a correct guess, Quintana?
Yeah, I would say so. And they're looking at early January, so just another couple of days to start pushing the vaccine out to other vaccine providers in the community. So early on, it was just the hospitals and local health departments, but I'm being told that early part of next month, some of our other, community providers will also begin to receive their allocations of vaccine so that they can begin to help vaccinate the priority groups, which means maybe we'll get to the general public in some of the later phases sooner rather than later. Looks like Debbie had a question. Will individuals be given a card with their vaccine info on it to assist with keeping track of what was given and when the next one is due, etc.? And that's a good question, and that's a part of the detail that I personally do not know. I feel like it is flagged in the CVMS system, so they will also be probably alerted that way. But yeah, I don't know the details of that logistical piece. Anybody else on the call? Are you aware?
That is so far what we have understood as they're getting the CVMS operational, that this card would be a part of that reminder. So they would know what they were given, because we don't want to mix. If you get Pfizer, get Pfizer. If you got Moderna, get Moderna. If there's a third vaccine available, just make sure you get the same. So it would help them with that recall date of when they should come back. And that is the plan. So I will say it that way. I think Rebecca can chime in too, but that is the plan, that they will get that reminder card. It's like a parking ticket at the deck. Don't lose it.
Donna's right. I think all of this is we should be getting our shipment soon that would have those cards in it. And so as soon as we do, we'll know a little bit more about what they actually look like. But that is definitely the plan. We'll be in close contact with people to make sure that they know when they are scheduled for their next dosage, though. So lots of communication.
Yep. Others?
For individuals who live in the outlying more rural areas, and some that don't have vehicles or ways to easily get to where the vaccines are available, is there a way that we plan to reach them if they're interested in becoming vaccinated? I would assume many are.
Yep, good question. And I assume we're going to do this the same way we did with the testing. So as we ramp up and resources are available, then yes, we will plan and figure out how we can go out to the community to ensure that they are vaccinated. But yes, we realize that is a barrier for many in our county. So yeah, we'll get those plans in place and we'll go out. For example, with the long-term care facilities, next week or this week, depending on when the vaccine actually gets here, we're not looking for folks to come to us. We are going out to them. So we will also have a mobile vaccination plan in place where we can also go out and provide vaccination in certain areas where transportation is a barrier.
Quintana, this is Theo. And I probably need to get with you and discuss this a little bit further, because I think we can provide some assistance with transport in the community, particularly to the rural areas. So
Great.
Great. We'll talk. We'll discuss further.
All right. Thanks, Theo. I appreciate that.
Quintana, this is Meredith. When do we think teachers will be able to get the vaccine?
So if my memory serves me correctly, I feel like teachers are included in phase 2. Teachers are phase 2, unless they have 2 or more chronic conditions, then they will be eligible in phase 1B.
And do we have any sense of when phase 2 roughly? Any estimates, time estimates?
We do not, again, because each week we don't know what our allocation of vaccine will be, and we have no way of knowing right now how many folks are interested in getting the vaccine. So it's just so many unknowns. But I know the state's request is that we work through the priority groups in order. So that's what we'll do. We'll first focus on trying to get everybody in the 1A group, then we'll move to 1B. We'll see if there's a 1C, and then we go to 2.
Thank you.
Uh-huh.
I guess I have a follow-up question. Do you have a sense, like, will counties be moving at their own pace? So will different counties be in different phases at different times?
So that's not the plan. And that's the reason that, the state has required us all to use the same priority group. And so as a report in CVS, that larger system that we're all using across the state, that kind of gives the state a gauge on how each county is doing with their priority group. So if we see, as we move through, they say, oh, well, this county is about done with phase 1A because they're no longer reporting, they don't have any more, then they wouldn't continue to allocate doses to that county for 1A, but they see another county that's still behind and, kind of maxing out their allocation each week. So they start to push more vaccine there. So the goal is for us to move as close together as possible. There's nothing perfect about this system and how we'll do it, but the hope is that we'll move to the different priority groups in conjunction together.
Thank you.
Uh-huh. see. Any more questions? Okay. I don't want to hold folks. I mean, it's I'll stick around in case someone's just shy and they don't want to ask in front of the whole group. But I'm around. Everyone, my email, phone number. So reach out if you have any additional or follow-up questions that you haven't thought of during this session, and I will answer them to the best of my ability. Again, this is a very fluid situation, and we get new information every hour. And so we try to pivot and make updates and changes as we get the information available to us. I just saw Deputy County Manager Travis pop up. Travis, did you want to add anything?
No, I just wanted to thank you for your time, and thanks to all your staff for all the hard work that they're doing. It's really greatly appreciated. Thank you.
Oh, thank you. Well, with that being said, I will say to everyone, have a safe, happy holiday. And I look forward to seeing you all in line as we get our COVID-19 vaccination. Everybody be careful, be safe, enjoy the holiday. Thank you.
Thank you, Quintana.
Uh-huh.
Hey, Renee.
Thank you.